Good morning. Let us study spleen under the following headings: location and dimension, surface and borders, relations, development, blood supply, interior and histology, its nerve supply and applied importance. Spleen is one of the secondary lymphoid organ. It is located in the left hypochondrium. It may also extend into the epigastric region. Okay. Now, if you see spleen, the spleen is related against three ribs: the 9th, 10th and the 11th rib. You can consider these three fingers as three ribs: the 9th, 10th and the 11th rib. And we can see the spleen is present along the long axis of the 10th rib. Okay, spleen is present along the long axis of the 10th rib. That is about the location of the spleen. If you see the dimension of the spleen, you can see the thickness of the spleen from these two areas. Okay, if you consider the thickness of the spleen, it is around 1 inch thick. Okay, if you see the breadth, this is the breadth of the spleen. The breadth of the spleen is almost 3 inches. If you see the length of the spleen, this is the length of the spleen. Okay, between the anterior and the posterior. If you see the length of the spleen, that is almost 5 inches. If you see the weight of the spleen, it is approximately 7 ounces in weight. 7 ounce in weight. Then if you see the location, it is located between, it is related to 9th, 10th and the 11th rib. So 9th to 11th rib. If you see, all these numbers are coming in odd, like 1 inch thick, 3 inch broad, 5 inch long, 7 ounce weight, 9th to 11th rib. So it is between 1 to 9. All the odd numbers 1 to 9. So this relation to the odd numbers can be called as Harris dictum. Okay, Harris dictum. Coming to the external features of spleen. The spleen has got two ends, an anterior end, see, which is broad. So this much is the anterior end. Okay, this whole thing is the anterior end. So this is anterior end which is broad, and we have a posterior end which is narrow. This can be otherwise called as, see, always the spleen is located like this. Okay, this end, the posterior end is coming more medially and the anterior end is coming more laterally. So it can be called as the medial end and the lateral end also. So the medial end is more narrow and the anterior end, the lateral end is more broad. The lateral end is more broad, the medial end is more narrow. Okay, so this is the position. Okay, with three ribs in place. Next, coming to the borders. Okay, so there are two prominent borders, one on the superior aspect, other one on the inferior aspect. Okay, if you see, the superior border is little sharper when compared to the inferior border, which is blunt and rounded. Okay, so we have a superior border and an inferior border. If you see superior border, the characteristic feature of superior border is these notches. Okay, there can be 2 or 3 notches which are present along the superior border, which is related to the development of this spleen. Okay, these notches are related to the development of the spleen, which is present only on the superior border. This helps to determine, to keep the spleen in anatomical position. So we can study one more additional border. Okay, other than the superior and the inferior border, we can study one more additional border which is present along the hilum, which is not very prominent, but it is present along the hilum. This border can be called as intermediate border. Okay, the hilum is nothing but the place where the structures either enter or leave the spleen. Okay, so this is the hilum of the spleen, and this can be considered as intermediate border. Okay, which is present along the medial surface. Okay, which is present along the visceral surface or the medial surface of the spleen. Okay, so these are all the borders. Next, let us study about surfaces. Basically, the spleen has got two surfaces. One is the diaphragmatic surface. This is the diaphragmatic surface, which is convex and smooth. Okay, convex and smooth. And then the next surface is the visceral surface, which is present along the medial aspect. Okay, which is having many impressions. Okay, which is having many impressions. So there are two surfaces. One is the diaphragmatic surface, which is convex and smooth, and the other surface is the visceral surface, which is related to the organs. If you carefully see, this intermediate border will divide the visceral surface into an upper part and a lower part. Okay, into an upper part and a superior surface and the inferior surface. Okay, this intermediate border is dividing the medial surface or the visceral surface into a superior aspect and the inferior aspect, or superior surface and an inferior surface. Next, coming to the relations of the spleen. Okay, this can be understood well by looking at this model. Okay, and compare with the specimen. Okay, so we can see this is the spleen. Okay, this is the spleen which is present along the left hypochondriac region. You can see it is present in the left hypochondriac region. Now, what you wanted to know is the other structures which are related. You can see this is actually the diaphragm, which is separating the spleen from. You can see this is actually the lung, covering the lung and the covering. That is the pleura. Okay, lung and the pleura. And you can see these yellow structures are the ribs, the 9th, 10th and the 11th rib. You can see the 3 ribs. Okay, 9th, 10th and the 11th rib. So the spleen, you can see it is located along the axis of the 10th rib. Okay, so this is the position. This is how it is situated in the abdomen. Okay, and it is separated from the thoracic cavity by the diaphragm. So this is what we have to understand. Now we will compare it with the specimen. Now this is the specimen of the spleen, and this is actually the diaphragmatic surface. So this is the surface, diaphragmatic surface. So this is related mainly to the diaphragm. Okay, and it is separated from the diaphragm by means of peritoneum. Okay, the peritoneum is lining the surface. The peritoneum is lining the surface. It is separating it from the diaphragm. This green structure is the diaphragm. Now, this diaphragm separates the spleen from that of the lung and the pleura. Okay, from that of lung and the pleura along the superior aspect. Only along the superior aspect. Okay, lung and the pleura along the superior aspect. Mainly the lung along the superior aspect and pleura which will be extending up to the inferior aspect. Okay, so lung will be extending only till here. Then the pleura will be extending till the end. Okay. Now, so beyond these two structures, that is the diaphragm and the lung and the pleura, we have the 3 ribs which are related, the 9th, 10th and the 11th rib. This is about the relation of the diaphragmatic surface. Next we will see the visceral relation. Okay. To understand the visceral relation, we need to know these surfaces, the superior surface and the inferior surface, which are separated by this intermediate border, and this anterior end is broad, and this area is another small area which is present along the anterior border. Okay, just medial to the anterior border. Okay, so these are the 3 areas. Now we have 3 areas: superior, inferior, and along the anterior end we have a small area. Okay, so these 3 areas are related to 3 important organs. The superior surface, the superior part of the visceral surface is mainly related to the stomach. So this area is related to the stomach. Okay. So if you see this model, you can see this is the superior surface. This is the superior surface which is related to the fundus of the stomach. You can see this is the stomach and this is the fundus of the stomach. So superior surface is mainly related to fundus of stomach. We can see if you remove. So this is actually the superior surface. This is how it is placed. Okay. This is related to the fundus of the stomach. Okay. Next, going to the inferior surface. The inferior surface, if you see the inferior surface, it is mainly related to the left kidney. You can see this is actually the left kidney. You can see the inferior surface is mainly related to the left kidney. Okay, this area. Now coming to the anterior end. So the broad anterior end. This is the anterior end. So this area along the medial aspect of the anterior end is related to the splenic flexure of colon. Okay, to the splenic flexure of colon. You can see this anterior end, this area is related to this area. Okay, this area is related to the splenic flexure of colon. So these are all the relations along the surface. And this hilum, okay, this hilum is related to the tail of the pancreas. Okay, related to the tail of the pancreas. So this is the pancreas, this is the tail of the pancreas, which is related to the hilum of the spleen, which is related to this area, the hilum of the spleen. Okay, along a ligament, the leno-renal ligament. So the tail of the pancreas present inside the leno-renal ligament, and it is related to the hilum of the spleen. So these are all the visceral relations of the spleen. Now coming to the development of the spleen. So this is actually the anterior abdominal wall. This is the umbilicus. Okay. So this is the posterior part, post-abdominal wall with the vertebrae. These are the vertebrae. Okay. This is actually the pubic symphysis. This is the diaphragm. Okay, that is the diaphragm. So this is the anterior aspect. This is the posterior aspect. Now what we are seeing is the gut tube. Okay, this is actually the gut tube which is suspended anteriorly and posteriorly by means of this mesentery called as the mesogastrium. Anteriorly the gut tube is suspended by means of the ventral mesogastrium, and this side posteriorly the gut tube is suspended by means of the dorsal mesogastrium. So this is the dorsal mesogastrium, this is the ventral mesogastrium. Okay, here at around at around 6th week of intrauterine life, there are multiple small swellings which will be appearing in the dorsal mesogastrium. These multiple small swellings which are appearing along the dorsal mesogastrium are the splenic nodules. These are the splenic nodules. It are multiple in number, and these multiple splenic nodules will finally fuse to form a single spleen. Because of these multiple nodules, the developing spleen will be lobulated, and finally these lobules will be represented as the notches in the border, notches in the superior border. So these are the representation of the lobulated spleen. Okay, the lobules which will be represented in the adult spleen as only the notches which are present along the superior border. You can see these are the notches. The gut tube changes its position and finally achieves its final position following the rotation of the gut. Okay, the spleen will be found to lie along the left side of the abdominal cavity. Now, at the same time, there will be an organ which will be developed along the posterior abdominal wall, and it will be ascend up, and it will lie along the posterior aspect of the posteriorly. It is related to the spleen. Okay, it is related along the posterior aspect of the spleen, and this part of mesentery which is extending between the spleen and this organ is the kidney. Okay, between the hilum of the spleen and the anterior border of the left kidney, this area, this part of the mesentery is called as the lieno-renal ligament. Okay, this part of the mesentery or the mesogastrium will become the lieno-renal ligament. Okay, and the part of the mesentery which is attached between the gut tube, that is the developing stomach. Okay, the greater curvature of the stomach, developing greater curvature of the stomach, between the greater curvature of the stomach and the hilum of the spleen, this part of peritoneal lining, okay, this part of the mesentery, okay, this part of the mesogastrium will form the gastrosplenic ligament. So these are the two ligaments which are attached along the hilum of the spleen, okay, which are developed from the mesogastrium. Okay, the gastrosplenic and lieno-renal ligaments. So when we talk about the ligaments, other than these two ligaments, there is one more ligament which is related to the inferior aspect of the anterior end of the spleen, which is related to the inferior aspect of the anterior end of the spleen. So this is the anterior end of the spleen. So along the inferior aspect of the anterior end of the spleen, there is one more ligament which is supporting, which is called as the phrenicocholic ligament, which will be extending from the diaphragm to that of the colon, transverse colon. Okay, that is actually phrenicocholic ligament which only supports the spleen, which is not attached to the spleen. These are all about the ligaments of the spleen. You see the blood supply of spleen. The spleen receives blood through this artery. This is actually the splenic artery. This splenic artery is a branch of the celiac trunk. This is the celiac trunk. This celiac trunk divides into three branches. One is the left gastric artery, then the splenic artery, which is the largest branch, then the common hepatic artery. This is the common hepatic artery. So it divides into three branches. Okay, this celiac trunk is the first anterior branch of the abdominal aorta. So that is the main source of the blood supply. That is the splenic artery, which is a branch of celiac trunk. Now let's study the fate of the splenic artery after it enters inside the hilum of the spleen. What I am drawing is the spleen, which is surrounded by the capsule. Okay, this is the capsule of the spleen which is surrounding the spleen. So this area is the hilum of the spleen. This is actually the hilum of the spleen. Once the splenic artery reaches, so now we are going to draw the splenic artery. Once the splenic artery reaches the hilum of the spleen, it divides into almost around 5 branches. Okay, 2 is number 3, number 4 and 5. So it divides almost around into 5 branches. This is the splenic artery. Okay, these branches of the splenic artery will subdivide. Okay, will divide and again subdivide. Okay, now let's see about the capsule. The capsule will extend inside, the connective tissue of the capsule will extend inside as trabecules. These are the trabecules. Okay, these are the trabecules. Okay, now after this artery subdivides into so many times, it will enter as the trabecular artery. It will enter inside the trabeculae as the trabecular artery. Okay, this is actually the trabecular artery. Now the branches which are coming from the trabecular artery will enter inside the parenchyma, leaving the trabeculae, which will enter inside the parenchyma. Okay, it will enter inside the parenchyma, where it will be immediately surrounded by lot of lymphocytes. It will be immediately surrounded by group of lymphocytes. Okay, so if you take a section here and if you study, it will be looking like this: a circular arrangement of lymphocytes, and this artery will be the arteriole. The arteriole is actually the branch which is coming from the trabecular artery, is actually arteriole, which is passing along the periphery of this aggregated lymphatic follicle, along the periphery of the aggregated lymphatic follicle, and this is called the central artery of spleen. And this aggregated lymphatic follicle is called the white pulp. It's called the white pulp. After it is surrounded by the lymphocytes, it will divide into many straight arteries. These straight branches are called the penicilli. Okay. There are some localized thickenings which are present along the walls of the penicilli called as the ellipsoids. These are called the localized thickening which are present along the walls of the penicilli are called ellipsoids. Okay. These penicilli along these ellipsoids will be the narrowest part of the blood vessel which is present inside the spleen, and the diameter of this ellipsoid, or the diameter of the lumen which is present inside the ellipsoid, is much smaller when compared to that of the size of the RBC. Okay. Usually the young RBCs are flexible and it can pass through this ellipsoid region of the penicilli. But the older RBCs are not flexible and hence it can't pass through be flexible, and hence it can't pass through the narrow ellipsoidal part of the penicillar arteries, and it gets destroyed and phagocytosed by the macrophages. At last, these penicilli will expand as a dilated part called as the ampulla, it ends as a dilated part called as the ampulla, where the blood will be in direct contact. Now the blood is in direct contact with that of the surrounding lymphocytes. Here, after this ampullary region, the blood cells will be in direct contact with that of the lymphocytes. Okay. Now there is direct contact of the blood cells with that of the lymphocytes, and this region is called the red pulp. This region is called the red pulp. From here, multiple sinusoids will arise, and this will carry the blood into the veins, which will carry the blood into the trabecular veins. In turn, all the trabecular veins will join together to form the splenic vein, which carries the deoxygenated blood from the spleen. Now, if you see the red pulp, This type of circulation which is happening inside the red pulp, where the blood cells are in direct contact with that of the parenchyma, that is mainly the lymphocytes, is called open type of circulation. And the type of circulation which is happening inside the before that region, inside the trabeculae and also inside the white pulp, is actually the closed circulation. Okay, and one more thing what we have to note is there is some specialized type of modified epithelial cells which are present along these sinusoids, which are called as stave cells, So this is about the splenic circulation and the interior of the spleen, and also a part of histology of the spleen. Coming to the venous drainage of the spleen, see, the veins of the spleen will join together to form the splenic vein. So the splenic vein is the major venous drainage of the spleen. You can see this is a highly tortuous vein, and this vein will be joining with that of the superior mesenteric vein. This is actually the superior mesenteric vein. Okay, the splenic vein joins with the superior mesenteric vein behind the neck of the pancreas to form this major vein. This is actually the portal vein. Okay, the splenic vein joins with the superior mesenteric vein to form portal vein. Okay, that is about the venous drainage. Coming to the nerve supply of the spleen, the celiac plexus are formed along the, you can see this is actually the celiac, this is the celiac trunk. Okay, this is actually the celiac trunk, which is a branch of the abdominal aorta. Along the celiac trunk, okay, around the celiac trunk, there is plexus of nerves which are formed. That is actually the celiac plexus of nerves. These celiac plexus of nerves will give the postganglionic fibers which will be passing along this splenic artery, to go and supply the spleen. So this green structure is the sympathetic nerves which are passing along the splenic artery to supply the spleen. Okay, these fibers are vasomotor to the spleen. Now coming to the lymphatic drainage, along the hilum of the spleen, we have this group of lymph nodes called the pancreaticosplenic nodes. These pancreaticosplenic nodes will drain the capsule and also the trabeculae. The lymphatics from the trabeculae and the capsule of the spleen will be drained through the pancreaticosplenic nodes. The lymphatic tissue, already the spleen is a lymphoid organ. The parenchyma of the lymphoid organ does not have lymphatic of its own. Only the capsule and the trabeculae will drain through the pancreaticosplenic nodes which are present along the hilum of the spleen, and it is related to the splenic artery. Okay, it's related to the splenic artery. Coming to the functions of the spleen is a very important part of reticuloendothelial system, and hence it is an important phagocytic organ. Okay, it plays an important role in phagocytosis and also in immune response. Okay, in immune response. Next important function is the spleen is a storehouse of RBC. So the RBCs can be released from the spleen whenever there is an emergency. Okay. Next, during fetal life, the spleen is a very important place where the RBCs are produced. So the main organ where the RBCs are produced in case of fetus is spleen. Okay, later on it will be replaced by bone marrow. But even in case of adults, the leukopoiesis, okay, that is the production of WBCs, are still continuing throughout the adult life. Okay, so the leukopoiesis will continue throughout the adult life. Next, the next important function of spleen is destruction of RBCs. The old RBCs will be it will not be very flexible. Okay, the old RBCs will not be very flexible. The small arterioles which are present inside the spleen will not allow the older RBCs to pass through, because the diameter of the older RBCs or the diameter of the RBCs are larger than the luminal size of these small arterioles. Okay, so only the flexible RBCs can pass through these blood vessels. If it is not flexible, in case of older RBCs, the RBCs are not flexible and hence it will be lysed inside the spleen. So it plays an important role in destruction of older RBCs. Coming to the applied importance of the spleen, the enlargement of spleen is called splenomegaly. This splenomegaly can result because of either infection, like case of malaria, or in case of any conditions which is affecting the portal system during the portal hypertension. Okay, so in many infections it can get enlarged. The spleen can get palpable below the costal margin only if it is enlarged for more than twice the size. Not just a small splenomegaly can never be palpable. It has to enlarge for more than twice the size to get palpable below the costal margin. Next applied importance is the spleen is very friable tissue. Okay, so during a road traffic accident, the spleen can be prone to rupture. In a rupture of spleen, there will be excessive hemorrhage. There will be a excessive hemorrhage inside the abdomen. Okay, so this can lead to shock. So this can be treated by doing a surgery of the spleen where we can remove the spleen. In that condition where you can remove the spleen is called splenectomy. The procedure in which the spleen is removed is called splenectomy. During the removal of spleen, one thing what we have to notice, the tail of the pancreas is very closely related to the hilum of the spleen. The injury to the tail of the pancreas may result during the removal of spleen. During the removal of spleen, sometimes the surgeons can injure the tail of the pancreas. In that case, the digestive juice from the pancreas can seep into the peritoneal cavity and it can cause the digestion of the tissues inside the peritoneum, mainly the organs inside which are enclosed inside the peritoneal cavity. Okay, and result in peritonitis, and it can result in peritonitis. So this is about the removal of spleen, splenectomy. At last, we can consider one developmental anomaly where the splenic tissue can form into these two ligaments which are related to the spleen. The gastrosplenic ligament. Okay, either the splenic tissue can be formed inside the gastrosplenic ligament or it can be formed inside the leno-renal ligament. Okay, it can be formed inside the leno means spleen. Okay, leno means spleen. So leno-renal ligament, which will be extending between the hilum of the spleen to that of the anterior aspect of the left kidney. Okay, so this area you can there can be accessory spleen which can be formed here, or it can be formed in other tissues also. The gastrosplenic ligament, the broad ligament of uterus, or it can be formed along the greater curvature of stomach and also along the spermatic cords. Okay, these accessory spleens which are developed in different sites are called spleniculi. Okay, So these are all the applied importance of spleen. Thank you.